Why is diabetic eye screening important? Diabetes is a health condition that can affect many parts of the body, including the eyes. Routine eye exams can help identify the early stages of eye problems and protect a person's vision. As such, it is advisable for a person with diabetes to have an eye exam at least once a year. Diabetes is a condition that interferes with the body's ability to store and regulate blood sugar. As a result, blood glucose levels may fluctuate. This can lead to high blood sugar, which can damage small blood vessels in the eye. This damage can cause vision complications such as blurriness, cataracts, macular edema, and retinopathy. In this video, we discuss the importance of regular eye screening for people with diabetes. Importance of eye screening. More than 30 million people in the United States have diabetes. This condition increases the risk of eye complications due to problems that are more likely to develop in people living with diabetes. Health experts may refer to these conditions as diabetic eye diseases. Diabetic eye screening refers to a way of detecting eye problems before they noticeably affect the vision. Screening is important because many of these conditions do not present any symptoms during the early stages when they are most treatable. Health experts recommend that people with diabetes have a regular eye exam once a year. However, a person should also check with a doctor how often they should undergo screening. Controlling diabetes and receiving regular eye exams can help prevent vision problems and stop conditions from getting worse. Common eye conditions that relate to diabetes include diabetic retinopathy. This condition is the leading cause of new cases of blindness among adults and the most common cause of vision loss among individuals living with diabetes. High sugar levels can damage the small blood vessels in the retina, which is the light-sensitive layer at the back of the eye. The early stage of this condition is known as non-proliferative diabetic retinopathy. At this stage, the blood vessels weaken and begin to leak. The resulting symptoms may be mild or non-existent. As the condition advances, it is known as proliferative diabetic retinopathy. This occurs when the retina begins growing new, fragile blood vessels that often bleed. At this stage, the symptoms are more severe and can include vision loss and retinal detachment. Diabetic macular edema. The macula is the central part of the retina that allows people to see color and fine detail. Diabetic macular edema describes a potential complication of retinopathy in which leaky vessels lead to an accumulation of fluid. This fluid causes the macula to swell, resulting in blurry vision. Glaucoma. Glaucoma is a condition in which fluid pressure rises in the eye, potentially damaging the optic nerve and leading to vision loss. Diabetes can damage the blood vessels in the eye, which can increase the pressure. As a result, people with diabetes may be more likely than other people to develop glaucoma. Cataracts. A cataract refers to a cloudy area in the lens of the eye. Cataracts commonly occur in older adults when proteins in the eye begin to break down. However, people with diabetes who experience high blood sugar blood vessel damage and swelling are at a higher risk of getting cataracts, which are also more likely to present at a younger age. Eye exam. An eye exam is a quick, simple and painless way for the eye doctor to check a person's eye health. The test allows them to check for eye problems early on, when they are easier to treat and before they cause vision complications. A routine eye test for a person with diabetes will typically involve a dilated eye exam. A doctor will give a person eye drops to dilate or widen their pupils. Dilating the eye provides an optometrist or ophthalmologist with a better view of the structures inside the eye to help them detect potential problems. During the test, in addition to check inside the eye specialist will check a person's vision, eye muscles, eye pressure and response to light. Depending on the results of the exam, the optometrist or ophthalmologist will advise a person on when they should next test their eyes. They will usually suggest that people with diabetes test their eyes yearly if they are otherwise in good health. However, a diabetes healthcare team may suggest a different plan depending on the type of diabetes and time since diagnosis.